Welcome to the Digital Transformationists podcast. This episode's guest is Eric Raymond, Senior Manager of Business Applications at Castlight Health. Castlight Health transforms employee benefits into a deeply personalized, simple, and guided experience, empowering better informed patient decisions to unlock healthcare outcomes and maximize return on healthcare investments. In this episode, we discuss the realities of contemporary American healthcare, how it affects industries and individuals, and what the future holds for medicine, health, and well-being. We also talk about the challenges of building a nationwide directory of COVID-19 testing sites, working with tech giants like Google, and saving the world one app at a time. Eric Raymond is the Senior Manager of Business Applications at Castlight Health. With over 20 years of experience in IT, Eric has worked across many industries, building and managing better systems, processes, and tools for organizations ranging from startups to billion-dollar enterprises. As a certified SAFe program consultant, he's helped architect and lead digital transformations, managed multi-million-dollar software implementations, and led agile teams on the cutting edge of information systems and technology. In his spare time, Eric enjoys the outdoors with his wife and kids. Whether it be dirt or mountain biking, peak bagging, or good old-fashioned camping, you'll find him blazing new trails in the mountains or deserts of the western U.S. on any given weekend.
So Garrett, I'm curious, how many run-ins do you have with healthcare? How is it easy for you?
Well, it's interesting that healthcare is our topic today, um, because it's actually been a big issue in our kind of small mom and pops business within the music industry right now. And the reason is because due to COVID, we had to recently like furlough or lay off
Hmm.
our only like full-time employee, because all the
Right.
other band and crew are like kind of gig workers that work when we
Contractual.
have gigs, but we have
Right.
we have my assistant manager. So our PP loan had run out, and we're looking right now at like the next 6 months with no gigs on the books. So we were kind of trying to figure out some way to figure it out. But long story short is that our 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 employee was worried about his health care, and
Hmm.
that was going to be, but also needed to collect unemployment benefits. So the question came up, well, could we float the health care? Well, health care is crazy expensive. So
Right.
the short end of the story was that we weren't able to cover the health care because we have no money coming in.
Hmm.
Okay, so this is just something that's come up right now, and just to have one employee covered for the year is like $36,000.
Wow.
So it's healthcare's
Yeah.
been on our mind big time. You know what I mean?
I bet. Well, yes. As an employer, you don't have a ton of employees, so it's hard to get some of the, I guess, benefits of bigger pools, right? Now, as an individual, navigating the healthcare system, it's really hard, right? And it's very hard as an employer as well. I've had to go through and evaluate which plan, to take, and then once I do have a plan, as an actually recent example, I had to go get a COVID test. I think it was just kind of a procedural thing where we're going to get a few folks together and we want to make sure we're all tested. But it was really hard to find an actual test center, and
Yeah.
there's insurance things and like all these things that like I asked my network of friends, but that was still a very time consuming effort. And I think there's a lot of great resources out there, but one of which is Castlight Health, which I'm looking forward to talking to Eric about some of the things they've done. But they've been pretty innovative in that regard as well. Did Have you gone through that process of trying to find
Yeah,
a
yeah.
place?
We had the same thing. We had, so right now for the small amount of gigs that we do have, if it people request to have a COVID test, or so we had a wedding we played up in Maine earlier this summer with the whole band, and the host wanted us to everyone get a test, but
Sure.
he was unwilling. He didn't want to pay for everyone to get the test, and so we didn't want to pay because the test costs like $160. Oh,
Oh
then
well,
we said, oh well, the band's not going to pay for the test. You guys want to throw in another $1,000 or whatever it is to get everyone tested?
sure.
Well, no, we're not going to do it. There's plenty of free places to get tested. Well, where are they? And then the band's freaking out. Well, we don't know where to go to get a test. So yeah, to your point, I mean, no one knows where to go. Lucky my wife she's pretty on point with that stuff, but not for everybody living in
Right.
Boston. You know.
Sure, sure. Well, employers are trying to do what they can to make healthcare easy for employees. And there's a whole, there's a lot you have to think about as an employer to be competitive, and that's providing your employees a really good experience when it comes to healthcare. Obviously, the employer wants to keep costs down. The employer wants to keep employees healthy and give a good experience to the employees. And this is a space where Castlight has done a phenomenal job. And with that, I'm so excited to introduce Eric Raymond of Castlight Health. Eric, thanks for joining us, man. By way of introduction, please, I'm happy to introduce you to Garrett Dutton, G Love. G, Eric Raymond.
Hey Eric, thanks for joining us, man. We're excited to hear your take on all this.
Garrett, it's great to meet you, and Christian, thanks for having me on the show. This is exciting, and you just hit the nail on the head with some of the challenges we're facing in today's healthcare environment, and I think it continues to get more and more complex with each passing day. So it's not a problem that's going away anytime soon.
Well, and when we think about health and wellness, environment, just all the kind of challenges that there are out in the world, social, we like to think that technology and innovation is going to help us through it. And, I think there's definitely, obviously very, very important to our success. And now that we've got, FDA approved vaccines, now the question is, how do you roll these things out? You got some complexities on a vaccine, everything from the temperature and how they're distributed. We got FedEx going on the West Coast, UPS on the East Coast. And at least with a Pfizer vaccine, you have to have 2 of the shots. So you also have to be sure that you're not taking a mix of different vaccines. But, if you take the first one, take the second one, it needs to be the same vaccine from Pfizer.
You can't mix the Moderna with the Pfizer to make a little COVID cocktail.
That sounds exciting.
Yeah. But, those are some of the topics I think we want to talk about. But to kind of set things up, tell us a little bit about Castlight Health.
Great question. So I'm fairly new to Castlight Health, actually, just 9 months in. Coincidentally, I started in March, the week, we're a Bay Area company, and we got locked down the very week I started. And so I haven't even been to the office yet. So
how's that for a welcome?
Yeah, but it's gone really well, and I've really been impressed with the way that Castlight has literally transformed the healthcare industry. And it's really exciting. I've been involved in technology now for 22 years-ish. But this is my first foray into the healthcare side of things. And it's so I don't have a ton of healthcare experience, but I've learned a lot over the last 9 months. And I think from an end user or an employee or a small business, person, we know the challenges that healthcare provides, each one of us, and some of the hurdles that we have to jump to make sense of all of this, and how expensive it's getting and how confusing it can be. And so one thing that I've really appreciated about Castlight is I believe they've transformed healthcare by creating the leading healthcare navigation platform for some of America's largest employers. Mm-hmm. And our health navigation platform connects hundreds of health vendors and benefits resources and other things like health plans into one comprehensive health and well-being experience. And one thing that we really strive to do is try to make it deeply personalized and guided for each individual user. And so that allows greater empowerment for the employee or the person that has access to Castlight to make better decisions, which ultimately unlock better healthcare outcomes for each one of us, and helps us maximize our healthcare investments, because as we all know, it's extremely expensive.
Yeah. Well, now, as you move a very complex thing and you move the complexity out of the hands of the individual, you're trying to simplify their life, simplify the way that they address and navigate healthcare. You then take on a lot of that complexity, and I'm sure you're building very robust, complex systems.
Yes.
The way you personalize health for any one individual, to me, seems very complicated, let alone doing that across however many, people on any one business and however many businesses that you're actually enabling this for. What What is your role in product management? What kind of products are you working on?
Good question. I'm primarily involved with a lot of the internal applications at Castlight, but we do some really big initiatives that definitely involve my team. For example, my team is responsible for Salesforce at Castlight, and that's a big component for this. This is something new that we just brought on board in the last year or so, but it's we call them our care guides. And it's adding to the digital component and bringing a human component in, because sometimes when we're navigating healthcare, we have our app, which is either a mobile app, Android or Apple, right, or desktop. Sometimes somebody wants a human touch, an actual person on the other end of the line. So we just instituted last year our care guides, and our care guides are a group of really talented people. They have average, each one of them, over 15 years of clinical experience. A lot of them are nurses. Or you can call a toll-free number and get support. And these people are very amazing. They can walk you through, for example, where to find the best doctor or specialist. If you don't want to do it via the app, they can actually help you negotiate your healthcare costs.
Right.
Like if you get a bill and it's not matching up with what you think it should be, they can actually negotiate on your behalf. And so that's really exciting. And so
it's very, very concierge, huh?
Exactly. That's the perfect word for it. So it's a very nice concierge service for helping our users get the most out of healthcare.
Nice. So that's a value you're bringing the company, the employer, and the employee, because otherwise they're taking on these questions anyways, right? So you're going to bring that level of experience to extend that to those employees as well. That's awesome.
Yep. And then there's a whole host of other applications that we use, and on the engineering teams, there's all kinds of exciting projects. I'm sure we'll get into talking about some of those a little bit later in the show. But there's some really, really awesome fun things that we're building and that really help improve healthcare and really make it, digitally transform the healthcare experience across the board. So I'm sure we'll get into some of those.
Very cool.
So the app is user-based and kind of helping all the people that are getting the healthcare. What about on the other side of the fence? Like how is it navigating for Castlight to work with everybody in the hospitals, the researchers, the doctors, nurses, receptionists, insurance agents, government employees, etc.? Like it's such a diverse group of people you got to work with on the other side as well.
It is. It's huge. I mean, healthcare alone last year, I believe the spend in the U.S. was $3.8 trillion. So it's a massive industry, and when you look at it, I think that's roughly about the size of Germany's GDP. And wow. So we spend a lot on healthcare as a country. And there's so many different players, and I'm just barely scratching the surface and getting to know what some of these players are. But like you said, you have health plans, and you have so many different these points of contact in the healthcare industry. And what I think Castlight has done a really good job of, and I'm not going to say it's been easy, but it's integrating all of these hundreds of different points of contact in the healthcare industry, whether they're providers of digital data or their insurance plans or their wearable devices, where we're tapping into wellness, different metrics, like for example, walking, number of steps per day, for our wellness program. It's a massive undertaking, and we have a lot of different teams across Castlight, and it takes a lot of coordination and effort. And I think it just takes a lot of communication and with these different vendors and partners. But we have a huge group of vendors and partners that we work with, and our ecosystem continues to grow day by day. It's pretty exciting.
Very cool.
Now the name of the company just makes more. I was casting light over
Light,
this
yeah.
crazy dark
Help you
That's
navigate.
situation.
Show you the way.
You
Let there be
understand
light.
it.
I get
Yeah.
it now.
I think that's exactly why it was named that. It was
Yeah.
created back in 2008 to cast light or provide transparency on healthcare pricing. Because as you mentioned, up in Maine, it was about $160 to go get a healthcare test. But if you had gone to perhaps a different doctor or you were in a different state, it could cost as much as a couple $1,000s. And so
Really?
we want to be able to show how much are these things costing so that the employee can make a wise decision and choose the best option.
That's so cool. So in order to make all this happen, obviously we have to be very digital. The way you're talking about integrating with all these folks, it's all APIs, right?
Mm-hmm.
And,
Yep.
and behind those APIs, obviously those companies, those partners have to be very digital in how they conduct and do business. Now you mentioned you do work with the Salesforce, but I also know that you work with the Atlassian products, and those are the tools that
Yes.
you also support, the software dev teams. Can you tell us about some of the practices and the tooling that your organization's using to build and bring value via technology?
Yeah, great question. Atlassian is one of my favorite products, actually, and I have many,
All
many
right.
years of experience with Atlassian, and Precipio has just been a huge partner with us in this endeavor as well. To
Awesome.
when we recently migrated from server to cloud, and that's a whole nother story in and of itself. But we use one of the things that I'm really passionate about and that I've been involved with for many years is. In order to be able to do any type of digital transformation as a company, I think you need to change your mindset because you have to be able to
Absolutely.
pivot and adapt on a moment's notice. And so I'm a huge believer in the agile framework.
Awesome.
And some of the old school ways of doing things, some of those old waterfall processes,
Yep.
for example, that were invented after World War II, are really no longer viable if you want to remain at the forefront. And the reason why is those old processes don't allow you to move fast enough to changing market conditions. And
Right.
we've seen that again and again. And so I believe you need to be able to fail fast, prove that something's going to work or not work, and then iterate on that process and pivot if you need to. And so we use Atlassian for that very reason. And a lot of the tools that we use are, support the agile framework. And we're a SAFe company, and for our listeners that aren't sure what SAFe is, it's Scaled Agile Framework. So it's taking that agile, kind of that Scrum, and expanding it to the portfolio level across the top of the company. And so that really is a powerful process that we use. And so we kind of plan on a quarterly basis. We use what are called program increments. We plan a quarter in advance, and we get all of our dev teams together and all of our executives, and we put together a game plan for the quarter. But that doesn't mean that we don't have to pivot when something comes up. A perfect case example of that would be, look what happened in COVID at the beginning of the year. When COVID hit, our company was able to pivot, and we partnered with Google to make the COVID test site finder. And I bet you, Garrett, when you were looking up the COVID test, that was our system that you were using, the COVID test site finder, because we partnered with Google and it directed, the search went right to it, and the Google Maps went right to the local location where you could get tested. And so what's funny about that whole thing, though, is I was starting just as that was taking place, and what precipitated it was an internal hackathon of our developers. They were like, because I think we do these quarterly. At the end of every quarter, we get together and like, hey, what would we like to do? And so a lot of engineers got together and spent a lot of man hours, and a lot of teams worked hard to be able to create this COVID test site finder and put together all the data in all 50 states for where to get tested. And it became a huge success, and it's what state governments use. It's what Fortune 500 companies use. So it was a big partnership with Google, and it turned out really well. And that's an example of pivoting quickly and using agile frameworks and tools such as Atlassian to make that happen.
Was that the first collaboration with Google for the COVID?
That's a good
testing side?
question. I don't have the answer to that because I'm fairly new. I don't know if we've partnered with them in the past on other things, but I know it was a big collaboration with them this year. So we also worked with Apple as well.
Well, it's so smart that Castlight carves out time and dedicates time to let people do what they think is good and it's a good idea. Atlassian's had a tremendous amount of success with what they call Ship It, which is a very similar thing. I think it's quarterly. Everyone gets like 2 days to just go off, come up with some crazy dream project and build something, and then see of all these projects, what's feasible, what can go back into a project or a product, and what can be carried forward. And Atlassian's done amazing things around innovation by just giving people that room to do those things. So cheers.
It really works, doesn't
cheers
it?
to y'all.
It's amazing. Yeah.
Eric, you kind of touched on the apps and stuff. So, of course, it's obviously, and you touched on the 10,000 steps. I mean, that's everyone's so into the health app on your iPhone and counting the steps and checking your heart rate. And it seems like at least from my perspective, our society, our culture is in kind of a pro health forward. Hopefully most of us, but so, I mean, sure, that's a wonderful thing for the healthcare industry, right? For people to be doing more preventative health, and just being healthy. So how does some of those apps, help make your job easier, what you guys are doing?
Oh, that's a great question. I think we all kind of started off, however many years ago, I don't remember exactly when, but we all got the Fitbit, right? And we had the Fitbit on our wrists, and it was exciting. And at first it was kind of a little bit of a novelty because it was like, it tracks my steps. That's nice. And, your heart rate. But it's amazing to see how the technology, and especially these wearable technologies, has advanced over the past several years. And now it's just, if you're into technology like we are, I think you're going to have one of these on your wrist, whether it's an Apple Watch. My wife loves hers. I have a Garmin. And not only can I track my sleep and my calories and my steps, but now I can track things like my VO2, even respiration and oxygen levels, which is really cool. It even shows me my stress levels. And at first, when I got the watch about 6 months ago, I'm like,
let's see it. Do you have it on right now?
Yeah, right here. It's the
sweet.
Phoenix. It's a sweet watch.
That's kind of slick.
But when I first got it, I thought, well, this has got to be some kind of marketing gimmick. Like, how could it know my stress? And I don't know how it works, to be honest. But as I've kind of monitored it and watched it, it does seem to do a pretty good job of identifying if my body's under stress, or, like if I had a poor night's sleep and, I'm just running and gunning at work, it kind of detects that. So there's some interesting things that are coming out now. And Castlight is integrating with all of these different tools, and we're collecting that data. And one thing, that we take seriously is privacy, so we de-identify the data, so no one person can be identified with whatever data we're collecting. But this kind of data can really help transform the healthcare industry as well, because it allows us to determine how people are doing. And I know that I remember my aunt about 20 years ago, she was talking to me, and I was just getting started in IT at that point. And she said, Eric, someday they're going to have a device that you wear on your body that's going to tell you exactly what's wrong with you. She was a nurse.
Right.
And that's coming to pass. It's really cool to see that. And we're just, on the cutting edge of some of those technologies becoming available. And we've seen a lot transpire, and it'll continue to grow, I think.
Sorry.
Go ahead, Gary. Go ahead.
Can I go real quick?
Yeah, please.
Just to your point, just what popped into my head while you're talking about that stuff, Eric, was and this is kind of almost creepy, but you know how like with your car insurance, what's the commercial right now? Like a safe driver's benefit is something on your app or something that.
Oh yeah, they install that module in your car.
Okay, so that's what it is. So is there something that exists like that through your health? So you got your Garmin watch, your wife has the iPhone watch, I got my health meter on my phone. Well, I don't know if people want their health insurance companies to have access to that, but what if there was a system like that where you're saying, oh, well, oh, look, Katie Thomas is she walked 10,000 steps every week this week, so her premium is going down by $100 a month now.
That's a really interesting concept. I don't think it's kind of gone to that level yet, but I could see something like that in the future. And One thing that companies are using it for, the data for right now, is for wellness programs. You mentioned earlier about the importance of preventative care, and healthcare or companies in general can save billions of dollars a year if they get their employees taking care of their health, just walking 10,000 steps a day, for example. And so one Castlight Health, our wellness portion of our app, allows companies to create challenges, which are really fun. And so, you can join up with a team, and they can, depending on how many steps you get in a week or several weeks, you can cater it to whatever you need to. But I found it to be actually really fun, and it really creates employee engagement. And what's neat about it is it actually drives employee behavior. They've proven that when you do those kind of challenges and people start doing these walkathons or whatever they're doing, it develops really positive habits, and it can really help. And so, so I don't know, that's a great idea of at some point in the future integrating it in with the health insurance. But for right now, at least at the corporate level, it does help save the company potentially millions of dollars a year, depending on how large they are, by getting people out and walking and monitoring their calories and all that kind of stuff, and our apps do all of that. So it's fun.
Think about how many people would be out walking like hardcore every day if they knew that, like, well, hold on, if I just don't go to McDonald's right now and go, have a salad and then walk around the block on my lunch, I'm gonna save $100 this month. That's crazy. That's like a slow hanging fruit.
There's some fun incentives, like our company gives Amazon gift cards. Once you get a certain number of points after walking, you get like a $25 Amazon gift card. And so I think I've earned a couple $100 this year in Amazon gift cards, and I won't turn that down. So it's fun.
That's epic.
Yeah, we have a similar program, so to speak. But one thing is people are afraid of big data and AI, and for good reason, right? Any technology has two edges, right?
For sure.
But I think if we can anonymize this data, and have that volume of information to understand, or data to understand people in general, are the larger population. I think we obviously going to pull some great information out of that'll benefit everyone without having a specific data point on any one individual. Is there any big data kind of thing or AI kind of thing that y'all are working on with regards to the information
That's an awesome question. I didn't know if you were going to ask that, but I pulled a couple exampps just in case that came up. So let me share a couple of these, and I've got the data in front of me, so I'm going to read a little bit of it. But the first thing is when we launched the nationwide directory of the COVID-19 testing sites, we used that data to build what's called a heat map. And it shows the spikes in infection or transmission rates in certain areas of the U.S. And so you could really drill down, like if you were in Houston or Miami, it doesn't, Boston, you could see where this was, where it was getting hit. And this was all from this medical real-time data. Of course, we de-identify and anonymize it so that we're not, as part of HIPAA. We know that HIPAA compliance is a really serious thing. But we for what we did is we did another study that just recently got published in the it's the Journal of American Medical Association, the JAMA In Network. It's a highly prestigious medical journal. And let me pull up the information here. So this is just last month we published this data in this peer-reviewed medical journal. And basically what we were in our study, and we were looking at, I believe, 3 billion records, somewhere in that neighborhood. Yeah, a lot of big data. We found that there was nearly a 70% reduction of preventive care for top health conditions in the U.S., such as colonoscopies and mammograms, due to COVID.
Because people don't want to go see doctors; they're afraid to.
Yeah, well, yeah, they're probably afraid to because they
want to get infected at a hospital or
exactly,
office.
Yeah.
Okay.
And so they're just holed up in their home waiting for this to pass. In the meantime, they're not getting these preventative care things done. And so we know, according to the CDC, chronic diseases such as cancer and diabetes are the leading cause of death and disability in the U.S. And this highlights the need for people to be screened for and kind of receive some of this preventative care for top chronic conditions. And so according to the some of the research, the American College of Oncology anticipates a dramatic increase in cancer over the next decade as a result of deferred cancer care. So that's another really sad thing that's happening as a result
Right.
of COVID that we found from this big data.
Right.
Another really cool thing that we were able to do was get some cost data on how much it was for COVID testing and treating COVID. And so what we used as the primary source of data for this analysis was a subset of 2.5 billion de-identified medical claims for primary care, urgent care, emergency room, lab tests, etc. And so we had the provider directory data, we had the provider rate sheets. That's something that Castlight's had for forever. We've had publicly available data. And then what we were able to do is put together a cost spectrum, really a range of what it costs in these different metro regions to get treated for COVID. And this is really interesting. I was going to show you here. So what we do is the procedures and services we included were the site of care, so whether it was a telehealth, primary care visit, urgent care visit, or an ER visit. We also looked at care for moderate COVID-19 symptoms, such as initial cost of a provider visit, influenza test, sputum culture and sensitivity, blood culture and sensitivity. I'm just reading off this document here, but pretty cool stuff. And then we also looked at things like chest x-rays, lab tests. So here's what's interesting. The analysis found that in Los Angeles, this is just one example of the study, the cost for a primary care visit and standard lab testing ranges from $304 to $4,447, roughly a 14-fold difference. Wow. So that's why you can see something like Castlight would be so helpful, because you can see on the app how much it's going to cost by going to, if you go to the ER, it's going to be through the roof. If you just go over to this clinic over here, it's only a couple $100. So that's the big difference.
But who's paying for it? Because like if for instance, my guitar tech, his father-in-law or his stepfather, he had maybe mild COVID and they had him in the hospital for 2 weeks. I mean, that's going to be
thousands. Yeah, exactly. Tens of thousands, that's big bucks. So, and I mean, we know the health insurance companies pay a big chunk of it, but where does that money come from? I mean, they've got to increase their costs, and that goes back into the consumers' pockets eventually.
Well, and this kind of casts light on the disproportionate impact on minorities and folks that have less income. If you don't have insurance, right, $4,000, and if you're low income, that's devastating. Some of us, $4,000 sucks. May impact us more or less, but for a lot of folks, that's a huge setback.
And that is one of the things that we found too, is that low income areas of the country really do suffer in this situation.
This is really cool. You kind of alluded to some upcoming stuff that you wanted to chat about. Is there anything y'all are going to get involved with to help with just tracking, what tests you've had, and not what tests, but what immunization you've had? Are you going to get the second one or the right one? Because that's just a big technology solution waiting to happen there.
Yes.
Anything coming down the pipe in that you can talk about?
I know that we are doing some work on the immunizations, and how attorneys can be sometimes. I talk to our attorneys, and we can't quite divulge anything yet, but there is a lot of work going on in that arena, and getting the vaccine out to the American people is a huge endeavor. So I know Castlight will be involved in that process, and
sure.
It's pretty exciting. But I think the biggest thing is we have a lot of this already, but just being able to Castlight offers the ability to search for medical providers, which is so powerful, and serve up those top ranked providers. We have this proprietary Smart Match provider search, and it identifies and recommends the highest value care, which is really cool technology, and it shows transparent cost and quality rankings, which is very, very powerful. Like we were mentioning earlier, being able to determine, am I going to spend $300 for COVID, or obviously if you're in the hospital, you're going to spend a lot more. But
right.
So the other thing that we're working on is what's going to become huge is telehealth. And the virtual care, and people are starting to get more I think, used to the idea of just basic stuff, talking to a doctor or a nurse remotely. We're getting used to it in our day-to-day jobs now, and so I think that's becoming more and more a huge thing. And so recently we added a visual icon to all the providers that offer virtual care. So if you go into the Castlight app, you can say, well, I don't really want to leave my house.
Sure.
I don't feel comfortable going to the clinic. I'm going to talk to somebody remotely. And so that's kind of a fun thing. And I think that's going to continue to grow.
Yeah,
Sure.
I think that's going to be, if you just look at it from just a everyday person's perspective. I mean, if you have, most of the time when you need to see your doctor, you need a prescription. When I'm on tour, in the wintertime, I tend to get like a terrible chest cold once a winter. And, if I was home and didn't have to sing every night, I wouldn't take antibiotics. But I need to take antibiotics when I'm on tour because I got to perform. So I'm in Kansas. My primary is in Boston. So, yeah, they're like, "Well, go to our urgent care." I'm like, "No, I'm touring. Just call it into the CVS." You know what I mean? Like,
Yep.
so the televisits are going to be huge for everybody, because most of the time you don't really need to be sitting in your doctor's office. Or I always had this other joke: if you have children and you take your kid to the children's hospital, they're more likely to get injured in the waiting room of the children's hospital with 40 sick kids running around going crazy waiting for their appointments. They're going to get more stitches there than they came in to get fixed. So this is going to be huge, the televisits.
Yeah, I think it's an exciting trend, and we'll continue to see it grow and grow. It's definitely the wave of the future.
Well, I'm going to go back to some of the Atlassian conversation we're having. You just did a migration. We just did a migration to cloud. What were some of the primary drivers for that? Because I think that decision and that project was before the big announcement on the server deprecation, effectively.
Yeah. Well, when I got hired, I asked my boss, I'm like, why are we not on cloud yet? Because I came from a company that was on Atlassian Cloud. And there's so many different moving pieces at Castlight. There's 1,000,001 projects happening all at once that it's hard, and Castlight had been using Jira since 2008 or 2009. So it's been around a long time. And our system was slowing down just because, we hadn't taken good care of it necessarily. There weren't any specific stewards over that data to manage it and just make sure that we were keeping the latest updates. So we were concerned, both from a data standpoint, a performance standpoint, security standpoint, and we're like, what can we do to mitigate this? And obviously the answer is go to the cloud. And Atlassian, and Precipio provided a great support in helping us do the migration. So they just needed somebody to come in and grab the bull by the horns, which I did, and kind of guided this process through with the rest of the business. But all in all, it was a big project, a massive undertaking, but it went really well, and it was really smooth. And, all things considered, I thought it was a big success. So we were happy about that.
Awesome. Well, thanks for trusting us with that. We take those things very seriously. Well, very cool. I'm glad that worked out so well.
Yeah, it was great.
Now, are y'all largely cloud centric, or are there more things to be done to move you from behind the firewall or on premise type situations?
I think Jira or Atlassian was one of the last on-prem things. But yeah, we're a cloud-based company. We're a SaaS company, and so we understand the importance of that. And so where we can, we're definitely moving that direction. So I'm trying to think offhand if there's any other things that are on-prem, and nothing comes to mind. So I think we're doing a pretty good job there.
Very cool. That's awesome. So tell us, what big plans did you have that got interrupted? Because much like Castlight's, quarterly planning and having a pivot, the whole world overnight had a pivot, right? All of us had these great plans for 2020. Yeah. What kind of things were interrupted on your side?
From a professional standpoint, or that's an interesting story.
Hawaii blocked, or
so I think we went to Hawaii in February before I got hired, and I think we ended up getting COVID when we were there. To be honest,
You
my
think
wife
so?
and I, we both got pretty sick, and we lost our sense of taste and smell. So that was a pretty easy indicator that we probably had it.
Oh, wow.
For a few days, and the cough wasn't fun. And so, I think we got it on the airplane over in February. So, but
Wow.
our big trip was Hawaii this year, and what we ended up doing was, I love the mountains. Actually, live in Utah,
Right.
and
Lucky
so
you.
we just would go up the canyon on the weekends to get away from the heat and up into the mountains, and so it was kind of fun family time, and so we just, instead of doing big trips around the country, we just stayed local and still had an enjoyable time. So for us, we were pretty fortunate, So hiking, mountain biking, dirt biking, that's the kind of stuff we like doing.
Very cool. No, you're lucky. It's a beautiful part of the country. So many beautiful mountains.
Do you go up into Moab?
That's one of our favorite places to go. Yep, we love Moab.
I got to go there for the first time this year, and man, those bike trails are unbelievable, man.
Aren't they? So did you
cool,
go biking?
Man. Yeah, we did. We went biking on with the seat that goes up and
rock.
down.
Oh yeah,
the slick rock, and it was it was cool. I mean, it was pretty technical to get thrown into, but that is something else, man. That was really cool.
Yeah, I'm glad you got to experience Moab. It's a great place.
So that's a good place to be quarantining.
Yeah. True.
So what are the things you have coming down the pipe, Eric? Let's go with professionally.
We're one of the big things for 2021, I think, is working on continually integrating our systems internally at Castlight, and we're just bringing on Workato, and I know you guys are going to be helping with that as well. We're really excited about Workato.
Great company.
Yeah, great company, and we're really excited to kind of streamline some of the processes that we use, like the onboarding process for IT and HR, and building some integrations into our systems to be able to allow that, and just take some of that tedious checklist work out that has to happen, and
automate
so much time. Yeah, automation.
Yeah,
that's my big push.
Very cool. So for those listening, Workato is a SaaS or PaaS platform for automation and integration. So you think of it as a middleware capability, but so much more beyond that. What's also really cool about their product is that it democratizes a lot of these capabilities as well. So the interfaces are super clean and simple, and it's just a super powerful tool for automating, and above all, I think orchestrating, so that when the employee gets hired in HR system X, all the right activities get triggered into Jira or Salesforce or wherever where accounts have to be created or provisioned. And then beyond that, I mean, great integration for other kinds of processes as well. I mean, anything you want to integrate or automate and orchestrate, it's a great solution. Well, that's really exciting.
Yeah, that's a big push. We're super excited about that. So, and then just continual, training, and Salesforce is a big platform. Atlassian, Workato will be big. We're using, a lot of the Microsoft Office 365 stuff as well. So just onward and upward. But we have a lot of internal tools, and we have, that's one of the challenges with big companies as they start to grow. You get all these different siloed tools that start creeping up, shadow IT they call it, we're trying to, where we can, consolidate some of those or integrate some of those to reduce some of those friction points between teams. So
you got a lot of good work ahead of you.
Yeah.
You guys are saving the world one day at a time,
Well, that's cool you mentioned that, Garrett, because that's what appealed to me when I got recruited. Actually, I didn't seek Castlight out. They sought me out, and the guy that hired me told me about the mission that Castlight's doing, and we really are helping people, and I can get behind those kind of things. I really enjoy that side of it, and so that's been a huge benefit. So,
right on. Well, keep up the good works.
Thank you.
Well, Eric, thanks for joining us. G, always good to see you, man. Thank you.
Thank you, guys.
Thanks, guys. It's been a pleasure.
Today's episode was brought to you by Workato. Thanks for listening to the Digital Transformationists podcast, brought to you by Principio Consulting. Be sure to visit our webpage to check out our other episodes, access show notes and links, and listen to some great bonus content. Like what you heard? Subscribe, rate, and leave us a review. And tell a friend. We love making new friends. I'm executive producer Katie Thomas. Victor Vargas is our engineer. Alejandro Caballero is our editor. Thanks for tuning in.